Good afternoon, everyone. Just to kindly advise you that we'll be starting the presentation in 1 minute. We appreciate your patience. Thank you very much.
Okay, so let's start. Good afternoon, everybody. Welcome to this meeting. Thanks for joining us today in this that is a very important event for EPF and the patient community. It is the first of two events that we are going to host in January in order to provide more and more information around the vaccine. The one today is more focused on the presentation of our new guide on vaccination and the vaccine as an instrument. The second one at the end of the month that will be announced today is more focused on the COVID-19 vaccine and the problems around it. It's clear that there is a connection between the two meetings and the two subjects, and so this is also the reason why today we have asked and we have invited two very important keynote speakers that will work together with our policy director, Kaisa Immonen, for explaining you where we are today when we're talking about vaccination. So today you will listen to Noël Wathion, Deputy Executive Director of the European Medicine Agency, to Isabel de la Mata, she's the Principal Advisor for Health and Crisis Management at the European Commission, and Kaisa Immonen, that is our EPF Policy Director. I think it's somehow even useless to say, but in any case important to remind that vaccination as an instrument seems to have lost credibility over the last years. This is the reason why 2 years ago, EPF has started a long journey in this field for keep on informing patients, for coming back to basic information to patients in order to provide to any patient that is interested in knowing more about vaccination, useful, scientifically proven and correct information from an unbiased point of view. That was the beginning of our journey. That is somehow that has taken us today to present our new guide on vaccine that we see as an important, essential instrument for getting first-hand information about vaccination. Why? We did that because we saw that the issues around the safety of vaccination were growing. 2 years ago, the Novax movement was at the center of the agenda when we were talking about the main healthcare problems. And unfortunately, the COVID-19 situation has shown the importance, the centricity of vaccination when it comes to healthcare. It's still an essential instrument for granting safety of the population, particularly during a pandemic or for avoiding a pandemic. So we wanted to offer a quality instrument in order to give a concrete possibility to to be oriented in a huge amount of sources. A lot of them are not trustable. We know that this is one of the main issues, and so we decided to, because this is indeed in our mandate, to tackle this situation, taking directly the responsibility of working on this theme. It's clear that it's not something we could have done alone, so I want to thank all our partners, all the people that have decided to help us and reviewing the document, in developing the document, and hopefully in sharing these documents. This is not the end of our journey. It is an important step that on which we want to build also future activities. Vaccination is essential, not only from a medical standpoint, but also because it's showing us how important it is to inform the population in the correct way, how important it is to give knowledge, trustable knowledge, how important it is also to give patients the possibility of empowering themselves, growing and knowing more. In an ideal world, many of the things that we will say today will be talked at school, but apparently this is not happening everywhere. And so it's our pleasure to take this step, and hoping that this will be a concrete help and will be in concrete useful for patients out there that are seeking for information. It's essential also to keep on working on this document, to consider that this document is an open document that will be developed for one very simple reason. Science is evolution by definition. Science is not something fixed. It's not something that stays there. It's something that evolves every day. Particularly in this field, new vaccine, new approaches to vaccine are there, and it's essential that the patients community understand and get the opportunity to understand what's happening. So with this said, I would like to start to get into the meeting itself, and to start with the first speaker that I believe is Kaisa. No, Noël is there, so okay. So let me introduce you once again, Noël Wathion, EMA Deputy Executive Director. Thank you, Noël, for being here. The floor is yours. Okay.
Thank you very much, Marco. Do you hear me?
Yes.
Thank you.
Very well.
Apologies, but we had some technical issues. I really apologize for this. So thank you very much for inviting us to this conference and to talk about a very important topic, which is about vaccine confidence in times of COVID-19. The points I would like to raise today are about vaccine hesitancy, an ongoing challenge in times of COVID-19, the agency's vaccine outreach strategy, progress on actions from that strategy, how you're engaging with patient and healthcare professional representatives, provision of information on COVID-19 vaccines, the new information material on COVID-19 vaccines that we are publishing, information on studies needed for approval of COVID-19 vaccines, our transparency initiatives for COVID-19 medicines, and then finally the conclusions. Next slide, please. So, vaccine hesitancy is in fact an ongoing challenge in times of COVID-19. There is of course already vaccine hesitancy before, but it's becoming even a greater challenge in times of COVID-19. We have put some quotes from like from Nature, etc., where we highlight some of the issues, which are high skepticism on vaccines and safety. We had that from the past with the measles outbreaks. We are currently dealing with a global public health threat. There are issues raised in terms of bad science, rumor spreaders, general misinformation, etc. For COVID-19 pandemic, there is an additional complexity in terms of the fact that we are dealing with new types of vaccines. We're also dealing with a disease that we are still trying to come with a grip with in terms of all the different characteristics of that disease. That also leads to a certain form of COVID-19 denialism. And then, of course, there is the issue about the fast-track development and approval as everyone tries to address the current pandemic situation. Next slide, please. So the EMA's vaccine outreach strategy, what is it about? Well, it is imperative that we listen and understand to public concerns on vaccines and vaccination, and that information from reliable sources address the need and concerns and also support informed decisions on vaccination. And the agency is in fact putting resources and efforts in this direction, and it very much welcomes the European Patients Forum's work to also address this need. What is the goal of this strategy? Is to increase knowledge of and trust in the quality, the safety, and with quality we mean the pharmaceutical quality, safety, and effectiveness of vaccines, and empower the EU public and healthcare professionals to take well-informed decisions on vaccination. Next slide, please. The objectives of the vaccine outreach strategy of the agency is monitoring and analysis of vaccine concerns, science outreach activities. It's also to collaborate with ongoing initiatives to improve information on vaccines, to strengthen strategic collaboration with the EU and international partners, and to expand, and it's quite important, the evidence on the safety and the effectiveness on vaccines, and to promote research and engagement. So we have a number of actions from this vaccines outreach strategy, and they are still ongoing. So we have engagements with patients, consumers, and healthcare professionals organizations, and they are supporting the EPF efforts on information, on informing the public on vaccination. Analysis of public concerns on COVID-19 vaccines, the new information materials on these vaccines, communication on procedures for COVID-19 vaccines, transparency, a very important aspect, and then contribution to the vaccination information portal content. Next slide. First, when we look at engaging with patient and healthcare professional representatives, we have been doing that for quite some time, and we have been doing them throughout the medicines regulatory life cycle, from the start of interactions with pharmaceutical companies up into the post-authorization phase. The agency has proven methodologies to engage effectively, broadly, and rapidly with our stakeholders. We have established a network of patients and healthcare professionals to involve in discussions and actions, and to respond quickly to their needs and to those also of the EU regulatory network. And we have established over the past years platforms for exchange of information with both patients and consumers and with healthcare professionals through the working parties, which primarily meet separately, but we also have joint meetings of those two working parties. And it has demonstrated quite a lot of added value working in this particular way. Now, of course, we are in a crisis context in the midst of a pandemic situation where we're trying to come to a grip with, and engagement with patients and healthcare professionals is even more important than ever. Therefore, we are relying on them as voices of civil society in scientific committees, not in all of the scientific committees, but in some of the scientific committees. We broadened the involvement of patients and healthcare professionals in the context of the EMA COVID-19 task force. It didn't have patients and healthcare professionals. We, over the past, since some months, we have now broadened the expertise, and we also have representatives of patients and healthcare professionals in the COVID-19 task force, which plays an important role in the rolling review of COVID-19 treatments. The communications that are coming out are being reviewed by patients and healthcare professionals. They disseminate the communications to their communities. We have regular updates on the pandemic and the actions that are being undertaken by EMA to the Patients and Consumers Working Party and the Healthcare Working Party. And we, of course, continue to respond to queries and concerns from the general public. And of course, that number of queries is increasing also exponentially. It's not only the pandemic which is increasing exponentially. Next slide. A very important initiative that we have taken and that we think was very well appreciated by the general public is that we have held 2 public stakeholder meetings. These were broadcasted live and were well attended. We had the first one on the 11th of December, and the purpose of that public stakeholder meeting was to inform the public and stakeholders about the regulatory process for approval of COVID-19 vaccines and what the agency's role is in their development, evaluation, and approval. We had something like 3,500 people who followed online through our web, and later on the number of people that has been looking at the video even increased to 6,000. Most recently, last week Friday, we had another stakeholder meeting. This was more focused. This was to explain the basis for the approval and the use of new vaccines, taking into account the Pfizer-BioNTech and Moderna vaccines, how their safety will be monitored and their rollout at national level. Here we had at the end, some 7,000 people who so far have been looking at the video. So we listen here to the people, to the public. It's not only a matter of being transparent, but also it is a matter of trying to engage, to listen to the concerns and try to address these concerns. While we are engaging with patient and healthcare professionals, the added value is, of course, that we gather critical input into crisis-related activities in the context of COVID-19, supports specific considerations such as discussions on vaccines, associated social challenges, we should not forget that, vaccine deployment, vaccine hesitancy, etc. It's also to channel public health messages directly to patients, healthcare professionals, and citizens. And it reinforces the legitimacy of the actions and trust in the scientific outcomes and in the EU system as a whole. How do we support, or how can we support the EPF activities on vaccination information? We believe that the initiative from the European Patients Forum is essential to provide information on vaccination to patients with chronic conditions. The guide, which has been developed by the European Patients Forum, consolidates practical guidance and fulfills a need for information for people with chronic conditions to make an informed decision about vaccination. And we contributed in an expert advisory group on an EPF project, which was funded by the EU on vaccination confidence. Next slide. So how are we communicating in terms of COVID-19 vaccines? New information on the development and approval of COVID-19, specifically targeting to the general public. Of course, we can always do better, and therefore we always are very, your views and your feedback is very much appreciated so that we can learn from it and further improve. We respond to queries from members of the public and media, press, public meetings, and social media on key developments. We have quite a lot of media interviews. I have to say we currently are inflated with these requests, so we have to make difficult choices in order to reach out as much as possible to the media. We have a limited number of people that are being used for this particular purpose. And we are providing content for this vaccination information portal, and we are supporting the European Commission. And finally, of course, there is a very important aspect in terms of safety communications that are being developed also together with the network. There is new information materials available on COVID-19 vaccines on our website. So we have developed quite a lot. We are also trying to streamline it in the best possible way so that we can guide everyone in the best possible way when searching for information on our website. We have a number of key facts, starting from why are vaccines to prevent COVID-19 urgently needed, up to will vaccines protect vaccinated people if the virus mutates. So we have quite a lot of information already available there. It is also put in a question and answer session in order to improve readability. COVID-19 vaccines, the development, the evaluation, the approval, and the monitoring, we try to explain in an as lay language as possible how we are operating so that everyone understands that the process that we are putting in place is a very robust process, and that people can be assured about the pharmaceutical quality, the safety, and the efficacy of the medicine. So we have already published, you see on your right-hand side, the information that has been published in this particular respect. Next slide. This gives you an idea about the overview, so how we try to present the language to the general public in terms of development, evaluation, approval, and monitoring, going from small-scale studies, in vitro, in vivo, then the various phases of the clinical trials, how the evaluation and decision is taking place, how to scale up production, of course, very important. You go from clinical trials to rolling it out in the national vaccination campaigns, and then also very important, the safety monitoring, the phase 4 studies that are being put in place once the vaccines have been rolled out. Next slide. Now, standard vaccines compared with COVID-19 vaccines, this has come, we have been confronted with these questions in terms of the timelines. So here you see a normal situation. In terms of normal, I mean when you're looking into standard vaccines, when you have the different steps and one follows the other a little bit, starting from the pharmaceutical quality, the non-clinical research, then the different phases of the clinical studies, then the scientific evaluation and authorization starts, the large-scale production and studies after authorization, and you see where the vaccine is becoming available for use. That is for the standard situation. So the next slide will present you with COVID-19 vaccines. You see that everything is more compressed because a number of studies are running in parallel. And that's why, of course, pharmaceutical industry is this possible for pharmaceutical industry without compromising, of course, the robustness of the studies, but they can be more efficient. They're putting more resources into it as well, of course, but a number of the studies are running in parallel. Then what is important from the EMA side is that we are starting with the scientific evaluation and the authorization at an earlier stage through the so-called rolling review, which is not a brand new concept. We did it in 2009 for the pandemic influenza situation, but we have further fine-tuned it, and then this leads then from the rolling review at a given moment to the mainly conditional marketing authorization process. Also here you have the large-scale production and studies after authorization, but you see that it is possible that the vaccine is available for use at an earlier point of time. Now, we're labeling it still here rapid approval processes in the EU. I'd rather like to use the word more efficient approval processes in the EU. It is important to emphasize that we are not cutting any corners. It's trying to see how can we be more efficient whilst providing the necessary guarantee in terms of the robustness of the scientific review process. So you have the early support for vaccine developers, and we are always saying to the developers, please contact us as early as possible for any particular scientific advice. And then, as I explained before, you have the rolling review up to the conditional marketing authorization. I mentioned in previous slide that the COVID task force plays an important role in terms of providing scientific advice and also the rolling review, and then it is handed over to the CHMP for the application for conditional marketing authorization. In the task force itself, you will see experts also from the CHMP, from the PRAC, from patients and healthcare professionals who are looking at those data. Next slide. Then we are explaining that regulatory standards will be maintained. This is extremely important. So we have the same requirements for pharmaceutical quality, for safety and efficacy as for other medicines in the EU, which is of course then subject to the scientific evaluation. The speed of development and approval is faster, it's more efficient due to the public health emergency. I mentioned development is compressed in time, simultaneous mobilization of human resources, and combining clinical trial phases or conducting some studies in parallel instead of carrying them out sequentially where it is safe to do so. So safety never will be compromised. Then we also have here a slide about user testing of key messages and graphics, consulting on the best channels and tools. We are, of course, involving patients, consumers, healthcare professionals, and learned societies in this particular aspect. That is a process which also runs in parallel. Next slide. Information on studies needed for approval of COVID-19 vaccines. Of course, we always will consider each vaccine on its own merits. So the benefit risk of each vaccine will be considered on the basis of the data that have been submitted. You have good data of high quality, they are being delivered on time. At that moment in time, we can be more efficient and we can, as a result, speed up. We published information on pharmaceutical quality, non-clinical and clinical studies. The focus on clinical aspects has been on efficacy levels for approval, also uncertainties on long-term benefits when vaccines have been first approved. It includes safety studies before and after approval. Enhanced transparency, what information is being published, medicines that have received EMA advice during their development, committee meeting highlights, minutes, and agenda. Some were already there, but some are new or be further improved. The start of the rolling review, the start of applications for marketing authorization, product information in all EU languages, not at the moment of the opinion, but a few days later. An overview of the vaccine and why it is approved in plain language using a Q&A format in all EU languages. There is the EPAR. There is the full risk management plan. We are relaunching again the policy on proactive publication on clinical data that we unfortunately had to stop some years ago because of Brexit, and then also the changes post-authorization and monthly safety updates. That is all part of the enhanced transparency. This is perhaps more difficult for you to read, but I'm sure the slides will be made available to you. And you see here the difference in terms of the various milestones, in terms of the standard practice for transparency and the COVID-19 medicines. There's perhaps one change that I have to mention, which relates to the publication of EPARs, where we said publish within 3 days of the marketing authorization, since now the European Commission has also speeded up the decision-making process and in fact is giving the Commission decision the same day as the CHMP opinion. We need to adjust this a little bit and we are looking into this. Next slide. And when I say adjust this, I mean the EPAR publication, of course. So this brings me to the conclusions. More than ever, reliable information, good communication, and transparency on vaccines remain priorities. The public needs to be able to access the data and understand the rationale behind important decisions on vaccines. It is important that the conclusion of the scientific committee is fully explained as part of the EPAR, of course, is put in lay language. Therefore, we have the medicines overview, but also that we have the underlying data published so that anyone who would like to have a look at it, or even would like to run a secondary analysis, that is all possible. Transparency requires extra effort to communicate better, put the data into context, and explain the science in plain language. Efforts by patients to support dialogue on vaccines are key, and it's not only a matter of transparency, but also of engagement, actively listening to the public and to our stakeholders and involving them in our activities. And with this, Marco, I hand back to you. Thank you.
Thank you, Noël. That was really interesting and very clear. I would take, while Kaisa is preparing, one question, actually two that I put together for you that I'm reading in the chat. I'm trying to put together the two questions. The first one is about if basically EMA is preparing any specific guidance for vaccination center on managing allergic reaction following the COVID-19 vaccination. That is something that is considered important and needed. And the second one, if it is about what do we know about additional safety studies in the pediatric population?
Yes, let me start with the second one. Indeed, we have to take into account that the vaccines that we currently have been approving states that for one it is as of the age of 18 years and the second one as at the age of 16 years. So we have to take into account that we currently, when you were approving the first two vaccines, that we didn't have any data below the age of either 18 or 16. And we have discussed with the companies involved that there is a need in order to run specific studies for the pediatric population. And I think that is also mentioned, if I'm not mistaken, in the obligations to the conditional marketing authorization. So it is something that the companies are required to do so. And we will, of course, follow this up very carefully, that they are sticking to their particular to that particular committee. As I said, if I'm not mistaken, it is an obligation, a legal obligation to the conditional marketing authorization. So they're legally obliged in order to run these particular studies. Now, if I understand well, your other question, Marco, was in terms of safety and allergic reactions, and if you're developing any particular guidance. Yes, so we have to, as I said before, the post-authorization phase, getting as much as possible information about adverse drug reactions will be extremely important in order to increase our knowledge base. Therefore, all the measures we have put in place in terms of facilitating spontaneous reporting is extremely important, and we do hope that how these, of course, we know that the vaccination programs will be run out differently in member states, but we do hope that the member states in there with these vaccination programs and the rollout take into account the fact that there is a need for the reactions to be reported. And certainly if you have these allergic reactions, which may happen some even quite quickly after the administration, that not only that is being taken care of, that the patient is being taken care of, but that also this is being reported to us, because what we don't know, we cannot act upon. So we know that there have been a number, very limited up to now, but of course we will monitor, we will discuss, we will see if there is a need to take action in terms of product information, etc. And then indeed providing particular guidance will then be the next step. But the first point is we need to get the information back. And this is, of course, a very unusual situation now. It's not that, certainly not with the two first vaccines, they are not being administered in the doctor's cabinet. So you have large vaccination centers. We do hope that all the logistics that are being put in place will also enable for these reactions, which may appear after, let's say, a very short period of time after the vaccination has been given, that these are reported back to us so that we can assume our responsibility. Back to you, Marco.
Thank you. That was very clear. We have other questions, but we take them after Kaiser's presentation. If you can stay with us, Noël, because they are mainly for you.
I will.
Okay. Thank you. So,
Okay.
Kaiser, the floor is yours.
Hi and good afternoon, everyone. I hope you can hear me well. I very much enjoyed the presentation by Noël Wathion just now. It really was very clear in putting into context the issue of vaccination and why it matters, particularly now. And I'm very happy to present to you today the EPF guide for patients called Let's Talk About Vaccination. I'll give you a little bit of information about the EPF engagement with vaccination, which did not start now, as Marco has said. And I'll also then briefly present the guide. Let's see how it looks. Can I have next slide, please? Before going into my presentation, I'd like to offer our warmest thanks to our collaborators, which Marco has already alluded to. We developed this guide together with a consultancy called Person Before Patients, and Ruth Wilson from that organization was instrumental in putting it together with us. And we'd also like to thank our two scientific researchers. Dr. Hanne Nøklebø from Norway actually reviewed the guide after it was put together to ensure it was fact-based and unbiased. And I would also like to really thank Rosa Gonzalez from the European Medicines Agency for doing a super quick review of the additional wording that we had to add on COVID-19 vaccines. And of course, Vaccines Europe, who have, with their funding, made this work possible. And I'd like to emphasize here that Vaccines Europe did provide us with funding, but they have had no editorial influence on the content of this guide, and no one from Vaccines Europe was involved in writing it. Most of all, I'd like to thank our patient group. Can you please go back a bit just still to see the names, because this was a very, very important part of how we developed this guide. We had a group of patient advocates from several countries, from several disease groups. The names are here. I will not read all of them out loud, but I think some of you are here today listening to us. So thank you very much for your commitment and for being so willing to share your experience and your insight. Next, please. For those who may not know EPF, I just want to briefly mention that we are an umbrella organization. We work with patient organizations across Europe and across disease areas with 75 members at the moment. We are an independent NGO, and we have a vision where really patient organizations are valued partners in creating equitable, person-centered, accessible, and sustainable healthcare systems. Next, please. Well, Noël talked about vaccination in the context of the pandemic, but we started working on vaccination already some years ago. Why did we do this? It's simply because we realized that, first of all, vaccination is a public health priority, and it was also becoming a very hot topic on the European health policy agenda where EPF operates, but also that it has a specific significance for people who live with chronic conditions, because patients are more vulnerable to vaccine preventable diseases than baseline healthy people. The underlying health condition can really increase the risks of disease for patients. And also some patients may be not able to take all kinds of vaccines, or maybe any vaccines, such as may be the case with some immunocompromised people. So it also matters to us more than maybe for the average person that everyone in society is vaccinated. And we really see this as a holistic issue. And therefore, patients are also ideal advocates for vaccination because it matters to us personally. So we wanted to address also the fact that there is data that the take-up of vaccination among patients with chronic conditions is maybe less than optimal as well. There are various reasons for that. Some of having to do with information, some having to do with access, for example. But also there is very little data of vaccine uptake in specific chronic disease groups. Next, please. So it has been mentioned that vaccination is an EU policy priority. Specifically, it has really come onto the EU agenda already a few years ago, before we even could dream that something like COVID-19 could happen. Already the previous Commission President, Mr. Juncker, mentioned it, and specifically equal access to vaccines as a priority in his State of the Union address in 2017. And of course, it's in line with the EU objectives of reducing the burden of chronic disease. And this started off a range of initiatives, including a Commission communication and a Council recommendation, which set out specific objectives and areas of action on vaccination, and a European Parliament resolution, which addresses specifically vaccine hesitancy. There's also an EU joint action that also kicked off in 2018, which includes 20 member states and also stakeholders. And EPF is involved in the stakeholder forum of this joint action. And as Mr. Wathion mentioned, we are also involved in developing a project under European Commission funding. So, as we've seen, vaccination is a more urgent issue today than it has been perhaps ever. We have a sort of dilemma in that the safe and effective vaccines are really the key to controlling the pandemic in the long term. And this is a societal issue. It is not merely an individual's an individual question of having a vaccine or not. So there is a need to develop and approve vaccines very quickly, as has been outlined. How is that possible? Well, Noël Wathion just showed us how it's possible, while keeping the same level of safety and efficacy. And at the same time, there's also this need to address the hesitancy and the misinformation that kind of float around in social media and in people's environments. And maintaining public trust is of utmost importance. So at EPF, we actively engage with and we participate in the activities of the EMA regarding vaccines-related public health communication. And also we engage regularly with the European Commission and provide updates to our members on this. We have a dedicated COVID-19 resource point, which you are very welcome to visit. It's not only about vaccines, it contains a lot more about how COVID-19 has impacted patient organization and patients in general. Next, please. So to give you just a little bit of history about our engagement with vaccination, we started also in 2018, coincidentally or not, with conducting a survey among our members to try and gain information about how they perceive the issue. And we produced a report based on the findings of this survey, as well as interviews with patients that we undertook. And we developed a toolkit of communication resources and tools, including a video, the report that I just mentioned, which is actually still a very nice reading and quite detailed, some fact sheets, which have been translated into several languages, and a PowerPoint presentation that our members could use. We also had 3 national workshops engaging with our patient communities in a national context. So together with our national or coalition members, we had 2 workshops in Romania, and then for the following year, we had one in Berlin. And at the end of this phase, we developed a manifesto. It's a manifesto on the importance of vaccination for people with chronic conditions, and it makes several recommendations for EU and national policymakers, but also healthcare practitioners. Next, please. I just want to give you a couple of very short informations about what we found during this work. The red asterisk here is really to indicate that this was before COVID. So these were concerns before the pandemic, and it may well be that if we go back now, we may find the same concerns or we may find them slightly different. But I think the information gap is something that is being very consistently mentioned by patients' representatives. It really concerned the lack of information on vaccination for specific chronic conditions. And respondents mentioned that it's very difficult to find such information and information that's good on the internet. We also found that there was relatively low engagement in the patient community on the topic of vaccination at that time in 2018, even though there was quite a bit of interest. So many organizations said they would be interested in being more active if they had more support, for example, resources. We also found that healthcare professionals are key providers of information to patients, and they are generally trusted. Patients generally tend to believe in science and to trust in medical information. However, they also said that they don't always get enough information on vaccination from their healthcare professionals, not proactively enough, and sometimes it's contradictory depending on which professional you speak to. They were also concerned about hesitancy, and particularly about hesitancy among healthcare professionals. Next, please. What did they want then? Well, we got a clear message that patients want information that's comprehensive, that can be relied on, it's evidence-based, and also patient-friendly and relevant, and disease-specific. They wanted information on the benefits of vaccines and also the risks, but specifying also that the risks should be communicated in a way that a person can understand and relate to, and they have to be put in context. And they should also be balanced with other risks, such as the risk of not getting vaccinated or the risk of having a particular disease. Of course, COVID-19 is resulting in new information needs, and for example, questions have been asked about the new vaccines that employ a different technology than existing vaccines, and how suitable are they for people with certain chronic conditions. We are working with our members to identify these new needs and to address them. The present guide that I'm going to present is not a guide to COVID-19 vaccines as such, so it doesn't contain too much information about these new types of vaccines. It's more a general guide on vaccination in general. One important message also that I want to convey here is the role of patient organizations. First of all, in our survey, they came up as a top source of information for patients. So patients clearly rely on their patient organization for such information. They can also support and coordinate awareness campaigns, also nationally and locally. They can share evidence-based scientific information and patient experiences, which can be quite a powerful way of conveying the message why it's important to vaccinate. They can also help counter misinformation and address vaccine hesitancy, which to some extent we get the impression that exists also in patient communities. And why would it not? Because patient communities reflect the population at large, but also among the public. They would like to work with professionals and with authorities more. And this was where there were some gaps between engagement of patient organizations, national authorities, and healthcare professionals, perhaps on a national level. Next, please. So based on all this work that we did before, we then decided that the next step would be to develop a guide for patients to try and address some of these information gaps. Next, please. This guide is for patient representatives, it's for individual patients, it's for patient organizations, and actually it's for anyone, but it was developed as a specific resource for patient organizations to help them strengthen their advocacy. It's clearly based on the insights from our previous work, and as I mentioned before, we developed it with professional communications experts, as well as a patient advisory group. And we really wanted to add information that patients would like to know in order to make better informed decisions about vaccination, and also to have better conversations about vaccination. So this is obviously, you can read this guide and find out a lot of information. It can also inspire maybe a different way of exchanging views with others who may think differently about vaccination. And it can perhaps give you a little bit of some tools that can help you make an argument in favor of vaccination. Next, please. The guide is really in two parts. The first part is the substantial information part, and this is where you will find information about vaccination, vaccines, and immunity in general. So you will find the history of vaccines, what type of different vaccines exist, how they work, broadly speaking, and how the immune system works. What is meant, for example, by herd immunity, and why does that matter? You will also find information on how vaccines are developed and approved, as like a step-by-step description, how that works in the EU, and also how their quality, efficacy, and safety is ensured, as was described from the EMA side. And you will find information for patients with chronic conditions, but I must also say that this is not very detailed, and it's not personal information for anyone, because it's not our responsibility or our right to provide medical advice as a patient organization. So we have addressed some generic questions and always recommend that anyone who wants to make decisions for themselves and needs help doing that should talk to a healthcare professional. We have discussed some of the risks of vaccines, putting them in context of the benefits. For example, we explain what the different things are that go into vaccines, such as adjuvants, and what is the implication? Are they dangerous? We answered some of those questions. We have included brief information on COVID-19 vaccines, but mostly it directs the reader to up-to-date information from reliable sources, such as precisely the sources that were presented that are maintained by the European Medicines Agency, because while this guide is not going to be regularly updated, those resources will be, so it's much better to rely on them. And of course, we include a lot of reliable sources, but people can go find more information. So the second part is then the conversation guide, and this is it's more of the, I would say, touchy-feely part of the document. You will read a bit about what makes it tricky to have conversations about vaccination, how you can try to reframe a difficult conversation, how you can try to focus on another person's concerns, and some practical tips like that. We've also included several links to patient stories. As I said, the patient voice can be powerful, and sometimes it can change an entire conversation, even in a country like like what happened in Ireland with Laura Brennan and the HPV vaccination. So testimonials are also included in that part. Next, please. So in fact, this is where I finish, and I wanted to finish with just to say that we hope you like the guide. We hope you enjoy reading it and using it, and please share it also. And we would also really like to know what you think about it. So if you have any feedback on how we can improve it further, please let us know. And I leave you with a picture of Borislava Ananieva here, who is a fantastic young patient advocate and a vaccines advocate. And yeah, we'd like to just tell you that vaccines work, and please find out how they work from the EPF guide. Thank you.
Thank you, Kaisa. So I would start with the questions. It's quite an interesting crossfire of questions that will start. I think the first one can be for you, Kaisa. Do you think the delivery of factual information is accessible to those more skeptical and hard-to-reach population that are heavily influenced by fake news? Because fake news proves potent in that, and it is fast media consumption where users make limited cognitive capacity available when evaluating the validity of information they encounter. How many times we have discussed that?
Yeah, thank you for the question. I will just say a couple of things in response. First of all, we know, and the research indicates that there are groups in the vaccine hesitancy. There is a spectrum of hesitancy, let's put it that way, which ranges from being slightly skeptical and having questions to completely denying vaccines. And obviously, it's a very small group that is a complete vaccine denialists, that are vaccine denialists. And and the research indicates that those people's attitudes are very difficult to change. However, the people who are in between and who just are unsure and have some questions, many times legitimate questions, or who don't know exactly what to believe because of contradictory information, can be reached with factual information, and can be reached not only with information itself, because that may not be enough, but by engaging with them and by really listening to their concerns. And it's also our intention to engage and be constructive and have this dialogue. So I am aware that we cannot reach 100% of people, but I think this is an important realization to bear in mind. Sorry, what was the second part of your question?
I think you have answered also to that, because fake news proves to be potent in the fast media consumption. So if I can add something, we have said several times that unfortunately fake science is much easier to be understood than the real one sometimes. That doesn't mean that we have to stop communicating real science, and we, on the opposite, it simply needs to get invested on that.
Yeah.
We really need to start teaching back, teaching science in school.
Absolutely. And if I may just add one point, which I forgot to say, was that I believe personally that there's also, the responsibility on authorities and regulators is enormous, because the communication has to be so quick, and you have to respond to the trends that are the way messages are flowing around you. And if there is a space left where there's no information, then that gap can easily be filled by misinformation. And so it's a real challenge, I believe, to organizations like the EMA, for example.
Thank you, Kaisa. And I want to start from here also for connecting to the subsequent question that is for Noël, because first I take the chance to thank EMA for having accepted our invitation a couple of months ago to host the public event. And EMA has even gone a bit further, hosting another one. They were really appreciated by the patient community, and I think it was the first time in history that actually a regulatory agency offered to be open, to open the doors in these, particularly during a pandemic, of course. So the question is if there is going to be another one planned, and in the case, when?
I'm reminded that I was muted. Technique is fantastic now these days. Yes, I think it went very well, and we are certainly planning to do other ones. What we would like to see, however, so perhaps the first one was a very general one to explain the overall process, etc. The second one was much more specific and linked to the first two approvals. We also had to take into account that for Pfizer-BioNTech, we had a press briefing because it was the first vaccine that we authorized, and on top it was using a new methodology, a new vaccine platform, the messenger RNA. We didn't do that for Moderna because we had the public workshop later on, and there was we made sure that we also had the CHMP chair and the PRAC chair there in order to reply. So we will be doing other ones. It would be good to hear from everyone what we can do better, because perhaps the second one was quite technical, and what we don't want to do is to have a kind of a CHMP, how should I say it, public hearing, so where you have, or an oral explanation where very technical questions come, and then you have, of course, very technical replies coming back. We should try to find the best mix, if I can say so. So that was perhaps something that we're also taking away as a lesson learned. And once again, therefore, is the impact, the input from and the feedback from everyone very important. What do you would like to see and hear from any future public workshops? And certainly now that we have approved the first two vaccines and other ones hopefully will come, we are entering into the post-authorization phase. So far, we have been lucky in terms of adverse reactions. We hope that it will stay like that, but there will also be other aspects such as the duration of protection, aspects such as will it prevent transmission of infection or not. So there are quite a number of questions which we were unable to answer at this moment in time, where certainly the phase 4 studies will provide us additional information, and it would be good to hear from the general public what do they propose in terms of additional topics or an additional view that we can have for the next public workshops to come. But they will come, so I can give you an assurance in that respect.
Thank you. I'm also putting together 3 different questions, but with the same somehow background for you, Noël. So, as you know, here we are representing a lot of different conditions, and so specific cohort of patients may have specific needs. So we are worried about the possible use of, if it will be possible or not, to use the vaccine in the patient population that is using on a daily basis corticosteroid, or that it is under biological medications, something like anti-TNF, for example, and more in general, if the vaccine could be used on the immunodepressed or immunocompromised population.
Yes, I'm not an expert in the field, so I'll try to do my best. What we have tried, of course, to do is to be realistic in terms of what the data are, what the data have demonstrated, and we are being guided by the available data and the scientific evaluation on the basis of those data. So I think that's an important emphasis to be made. When we are uncertain, because we do not have the data, that we try to reflect as best as possible in the product information, being it for the healthcare professional or for the individual persons who are being vaccinated. So indeed, there are some areas such as the patients where the immune system has been compromised, where we are saying, look, in terms of safety, we don't see any particular issue, nothing has come up. In terms of efficacy, we don't believe that there's going to be a problem, but we state that uncertainty because there is still an uncertainty. And then comes, of course, the question, how is this being rolled out nationally, where then, of course, you have the national vaccination organizations, which will have a look at it, which may provide additional guidance. Hopefully, there will be some alignment throughout Europe of any additional guidance that is being given. So we hope that we will also gather more evidence with the additional studies that will be conducted, where we have stated that either companies will have to do that, but as you know, Marco, the agency has will put in place studies that we finance from our own budget, and also studies for which we have received funding from the European Commission. So uncertainties, if they currently are there, they are reflected in the product information. It will be an evaluation which has to take place by the healthcare professional who can advise the patient concerned in the best possible way, whilst at the same moment we are trying to gather more evidence through additional studies that are being conducted. Over.
Thank you. That was very clear, and I think the same answer can apply to other 2 questions, similar questions about the use of the vaccine during pregnancy, and the use of the vaccine in population with cardiac problem, diabetes, and chemotherapy. That was somehow covered by the immunocompromised.
Yes, and when you look at the clinical trials, a number of when you go to pregnancy and lactation, for lactation we state clearly that there is no reason in order to think that there's going to be any problem. And for pregnancy, I mean, these were not included as such in the it was not one of the parameters to include them in the clinical studies. There are a number of persons who have become pregnant in the meantime and were enrolled in these clinical studies. And here we say it really needs to be a decision taken by the healthcare professional, taken into account the severity of the pandemic, I would say, and the risk that the people will be running. In terms of the other, so people with underlying underlying diseases, with chronic conditions, etc. Here as well, a number of them have been included in clinical trials. Perhaps the data set will not have been that wide as we would have wanted in order to provide very clear recommendations, and also that is acknowledged. So we hope that in the product information, so we hope that we will get more information on these. But if you look at how it is rolled out, the vaccination schedules, you will see, I mean, I can talk from my home country, Belgium, that you have those persons are part of the first waves of vaccination.
Thank you.
Over.
Kaisa, how can fake vaccination news be countered?
Okay, I think this is a bit of an extension to the previous, what we discussed before. I don't see that we can ever get rid of misinformation. I prefer to talk about misinformation and false science, let's say, that information that masquerades as scientific but is not, then fake news because it's associated by a certain person that we don't want to mention. But seriously though, I think what is important is that good and reliable information is at your fingertips when you need it. So it's really important that not only that reliable authorities and organizations produce it, but I think it's also a wider issue in that it has to be, most people use the internet now to search for information and social media. So it requires the collaboration of providers of these services to make sure that they promote this information. There are ways to do that with algorithms and so on. So I think that it has to involve many factors. Thus, the information has to exist, and then it has to be findable easily. So it's a challenge for also for the tech industry and for the wider society.
Okay, and then what advice would you give to patient organizations that want to promote vaccine information?
Well, I would say, first of all, look at our resources and see how you can use them in your own communities. And if you have specific needs and would require support from EPF, we would be always happy to help you and to have a dialogue with you. We would also like to learn from you, actually, from your communities. If there is something particular, some particular need for information, for example. So I think working together and maybe also looking at what other patient communities have done already. We try to be a hub also that brings together all the knowledge from the different patient communities. So let us know what you're doing.
Thank you. And another question is, in concrete, where do we find the link to the guide?
I think I need to defer to my communications colleague Dante in this question.
Yes, to all participants, we'll email the guide and the slides from today's event either tonight or tomorrow morning.
And I'm assuming it will be online tomorrow.
Yes, exactly. You receive the link, so everything will be good.
Thank you, Dante. Also, you can refer to Dante. Sorry?
No, sorry, I was just going to say we are aiming to print it, but of course with the current situation, people are not really going out, so we have deferred the printing until a slightly later date. And if we need to update the information by then, it will be easier to do it when it's still an online document.
Okay, and as Dante has joined the discussion, you can also refer to him for those participants that are requiring a certificate of attendance of this meeting, and he will provide. We will give the address at the end of the meeting. We have another couple of questions, but I think they are more for the European Commission, so I would postpone them after. And so I'm asking now to every participant if you have any other questions for Noël or Kaisa. Otherwise, we can move forward with the next speaker. Let me check on the. Okay. I think. Do we have more companies who asked the authorization? That's another question.
Okay, I can, while you continue searching, I can perhaps reply to that one. So whenever, of course, you're in contact with quite a lot of vaccine producers, and also, let's not forget, we're also in discussion with quite a lot of companies for therapeutics, so monoclonal antibodies and etc. So whenever, what do we publish? We publish the moment that we are either starting a rolling review, and so there have been 4, or when we start a conditional marketing authorization following a rolling review, and for that we have 3. Yeah, so we have in total only 4 companies. From the 4 companies, 2 have been finalized. Rolling review, which is ongoing, is for the Johnson & Johnson or Janssen Pharmaceutica vaccine, and then for one vaccine, the rolling review is now has moved to the next step, is the conditional marketing authorization, which is AstraZeneca, Oxford University. So those are the 4 which are in a quite advanced. The latter 2 are in a quite advanced stage. There will be more coming up over then the next weeks and months to come. And certainly in the field of therapeutics, when we start the rolling review, we will be mentioning that to you. There are a number of them in the pipeline.
Okay, thank you. As EPF explored the disparities across member states in terms of hesitancy, how approaches and messaging may need to differ.
Sorry, I didn't understand the question. The last part of the question.
If EPF has explored disparity across member states in terms of hesitancy, and how to approach and messaging if the messaging may need to differ.
We have not, apart from our survey, we have not done a particular research project into this. It would be quite an extensive exercise to do it, which we don't have resources for at the moment. But of course, there's other research from the Commission, from WHO, and from ECDC, for example, on vaccine hesitancy and the trends in Europe and globally. So yeah, that's not something that we can do at the moment.
Okay, thank you, Kaisa. So I would like to thank both of you for 2 brilliant presentations and for being so clear also during the Q&A. If you can stay with us, you're welcome. And meanwhile, I know, Noël, it's a quite a peculiar moment for working at EMA. So thanks for being here. We have really appreciated your presence here. Hope to meet you soon in person, and see you at the next event. Thank you.
Thank you very much, Marco, and I wish good luck and carry forward with the very good work that the European Patients Forum is doing.
Thank you. Thank you very much. So let me invite now to take the floor to Isabel de la Mata, as I said before, the Principal Advisor for Health and Crisis Management at the European Commission, DG Health and Food Safety. Thank you for being here. Thank you for having accepted our invitation and for having found the time to dedicate to us on this very special day for us. Thank you.
So thank you very much, and good afternoon, everybody. Sorry, I don't have any presentation, and coming at the end, I have the impression that you have already said everything that I have prepared. I mean, between Noël and Kaisa, they have made a presentation of all the different activities of the European Union that has taken on vaccination. Nevertheless, I'm going to try to explain what we are doing, why are we here, and how are we tackling the issue of vaccination and confidence on vaccination. So you know that the vaccination is a main activity for the member states. They are the ones that have the main competency on vaccination, but the European Commission assists the member states, the EU countries, in coordination the policies and the program. So we have been working in the prevention of infectious diseases.
Isabel, sorry, we have lost your audio connection.
Okay, now?
I cannot hear you. Okay, now it's fine. Thank you.
So I was saying that I will try to explain what we are doing, even if many things have already been said by the previous speakers, and that even if we were working since the beginning of the SANTE on vaccination issues, supporting the member states, our activities had the strong input or were strength in 2018 because of the situation in 2017 and 2018 with the extraordinary number of cases of measles in the European Union countries, and with several deaths in children and in adults in the European Union. So in 2018, the Commission approved a Commission communication, and then the Council approved a Council recommendation on vaccination, with several points that needed to be followed up and that have been followed up, with a roadmap for the implementation of the different actions. Among the different actions, there was a coalition for vaccination that is composed by the European Association of Healthcare Workers and also student associations that try to support the delivering of information, accurate information to the public, to the general population, and fighting the myths around vaccination and vaccines, and also exchanging best practices. The main association are the Standing Committee of European Doctors, Pharmaceutical Group of the European Union, and the European Federation of Nurses Association. So the main health professionals that are involved in providing information, but also providing vaccines to the population. Another important activity is the European Vaccination Information Portal. So one of the things that we saw is that what is missing is accurate information for the population. I mean, it's not true that a lot of the people are anti-vaxxer. They could be hesitant on vaccination and hesitant because they don't have all the information. They don't have the information that they need, and they don't have the accurate information. So they have questions. They question to themselves, and they question to the health professionals about vaccines and vaccination in general. So with the support of the ECDC, we established this European Vaccination Information Portal that is addressed to the population in general, and that provides information in general, I mean, about the different vaccines, vaccine facts, but also for specific vaccines more in detail, like the human papillomavirus, the influenza of the measles, and accompanied also by fact sheets on different diseases. This is entry point that at the same time send the one that consult this website to the different trusted sources of information in the member states, but also the WHO or other information sources, because it's true that there are also other non-trusted sources, so that don't provide the adequate information, and that sometimes they mislead the population. So we in 2018, when we were approving all these different council recommendations, the Commission communication, we were based in scientific advice, and there were four main studies or documents that supported us in our work. And the first one was study on the organization and the delivery of the vaccination services in all the member states, to understand how it's organized, and if maybe the differences in the organization could explain some of the difference in the beliefs and in the coverage. We also requested to the expert panel on health system that the Commission established a report on enables and on the contrary factors that could affect negatively the delivery of vaccines. We had a Eurobarometer on European attitudes towards vaccination, and also a confidence report on vaccination. This confidence report showed that the situation was worrying in some member states more than in others, regarding the confidence on vaccination, of course. We were following, after 2 years of having working with different activities on vaccination, just 3 weeks ago, we published the confidence report on vaccination 2020. And what we have seen is that the situation has changed positively in general, so that since 2018, the overall confidence has increased in all but 4 countries, that the percentage of respondents agreeing that vaccines are safe in general was higher, but in just 1 country dropped by 5%. That is quite important. That the confidence in MMR, measles, mumps, and rubella vaccine, has increased across many European Union countries, but the confidence has decreased in 1 country, and that almost in every country we have seen a considerable increase in the perception of the importance and safety of the seasonal influenza vaccine. So the change for the flu vaccine that was not so positively perceived in 2018, this has changed positively. We were trying also to see which could be the determinant of vaccine confidence. And there were not many factors, but I mean, it was not the equal distribution in all the EU countries, but we saw that when there is a difference by sex, for example, women are less likely than men to have high confidence on vaccination. This happened in 11 countries. And we also, regarding the age, what we have seen consistently is that the older population, over 65, have a higher overall confidence in the vaccination. That is maybe the explanation that we see is that the older population, they have seen the times when there were no vaccines, and that when the children were really dying because of diseases like measles or pertussis or diphtheria, and so they remember the time before and after vaccination. They can see the difference, and like that they are more pro vaccination than the rest. We have seen also in health professionals that the confidence is higher than in the general public. I mean, this is normal, I will say. I would be worried if the health professionals were hesitant or were less confident on vaccination. But still, it's not the same in all the European Union, and there are differences, and especially there are differences again regarding HPV and flu vaccine. But but also another thing that we have seen is that when there is a high confidence in the healthcare professionals about the safety and importance of one vaccine, and we study especially the case of HPV, there is a high confidence in the safety and importance of the same vaccine in the population. So this is why it's really very important to have the health professionals prepared to respond the questions of the population in general, and also of the patient. For regarding patients, not general population, but patients, you know, was said before that we are working with the European Patients Forum in this vaccination confidence, patients and professional awareness, communication and trust, the Pact pilot project, and that there will be soon some workshops addressed to professionals and patients. And we are very happy that this project is going on, because we think that this is important. Not only to conscientiate the general population, but also the patients, because their specific situation, and because they have to be more attentive sometimes, being sure that they are vaccinated, but at other time they cannot vaccinate, and they need to make sure that the people around them are vaccinated to protect with this herd immunization then the person that cannot receive the vaccine themselves. Regarding the situation that we are living now, COVID-19 pandemic, in June 2020, the European Commission presented the European strategy to accelerate the development, manufacturing and deployment of vaccine against COVID-19. And in October, we adopted the vaccination strategy with the key elements that member states should take into consideration for their COVID-19 vaccination plans, and the priority groups that will need to be vaccinated. So we have a challenge with that. We have seen that the confidence on the COVID-19 vaccination is, I mean, we have a challenge there in some countries more than in other. But for the last figures that we have even in the European Union, there are countries where 30% and more of the population, and they will reject the vaccines. And in many countries, even in the ones that are best places and that are more confident in the vaccine, there is even a percentage of 15% of people that will reject the vaccine. So this is worry, because the vaccine for the COVID is at this moment this is the only mean that we have to fight and to win to the virus. And if we have high percentages of rejection, this is a problem. At this moment, you know that we have concluded the advanced purchase agreements with 6 leading companies, manufacturers. We are discussing with 2 other ones. Other purchase agreement. At this moment, we have secured 2.3 billion doses of the COVID vaccine. When the companies are developed that, at this moment, you know that we only count in vaccines coming from 2 companies, but this will come. And the vaccination is ongoing in all the countries of the European Union, with the different number of doses administered administered, and percentage of population cover is still, I mean, slow pace because the dose is just arrived at the end of the year, and the vaccination programs in member states have begun end of the year, or even in some countries already in January, and accelerating the vaccination is a priority for us. And especially now that we have new variants of the virus that are coming to the European Union, and that can still be beat by the vaccines that are available, but we need to accelerate. What we expect is that by the end of February, we will have completed at least a minimum of 80% of the vaccination of the very old population, so the people that are living in the long-term healthcare facilities, and other people that are outside the are at home, but that are over 80 years of age. And we also expect to vaccinate the same percentage of healthcare professionals and social care professionals. And the next group is the people that suffer from some conditions, and so that are more vulnerable than the general population. We hope that we will achieve this goal, and because it's the only way out of the situation where we are now. We have a plan. We are working with the member states and even we have a toolkit to increase the confidence of the population in the COVID-19 vaccine. So not just for the general vaccines, as we have been working until now, but also especially for the COVID-19 vaccine. We have included in the European Vaccination Information Portal information on the COVID-19 vaccines addressed to the general population, so how the vaccines work, the development and approval, the monitoring of the safety of the vaccines, and also making the links to the Commission, to the EMA, etc., to other entities that are involved in the process. So vaccination, as I said, has been a priority in the last years, still continue to be a priority. The EU for Health program that in 2020, apart from supporting the coalition on vaccination, has 3 projects to support vaccination on vulnerable groups. Will continue in 2021 to support the vaccination in general, and has demonstrated that the vaccine is the first primary prevention method, one of the most effective. So we have been doing vaccination since 200 years, and more intensively since 70 years. But we need to make a reminder that the traditional vaccines, if we see less cases of some diseases now, is because we have the vaccine and we have been vaccinated. And if we stop vaccinating, we will begin to see more cases again. And one of the good news, for example, is that this year the flu vaccination has increased. Not only the result that we had in the confidence report, but also in terms of coverage that we have attained with the flu vaccination in 2020 in this campaign that began in September. The percentage, the coverage of the population has been higher because I think that the message that in order to avoid having the ICUs, intensive care units that are already busy with the COVID patient, also busy with flu patients, was something to avoid, and that we needed to protect against other infectious respiratory diseases, in order also not to confuse with the COVID, but also to make anything possible to avoid the COVID. And we know that the people that are already sick or that have previous diseases and concomitant diseases, respiratory diseases, are more vulnerable to the COVID-19. So this has been a good result. So we need the support of everybody, professionals, patients, public. We need your support to continue to pass the message and to continue to have high numbers of coverage of vaccination in general and also for the COVID-19. So thank you very much, and we count on you. Thank you.
Thank you very much for all these information that are precious to us. It was important also to listen certain messages that you wanted to deliver today. We have a few questions for you before closing the meeting. Just a second, because I have some problem with that. To which extent the EU citizens know and access the EU information portal on vaccination? And does the Public Health Institute of Member States also refers to the EU portal?
And the EU portal has been made in collaboration with the Public Health Institute of the Member States. So there is a group that is led by the ECDC that has been working on that. Also, the Health Security Committee has been not only informed but consulted about the portal. And the portal also refers to all the vaccination pages of the member states. So there is a collaboration and they are informed. We have been trying to disseminate this vaccination portal by all the means. Still is not so, I mean, it's quite recent, but we continue to do to the general population wherever and whenever is possible. But also we count on your support to disseminate the existence of this portal. Thank you.
And another question, always on the portal, how often and how quickly the info is updated, particularly in this period?
It depends of the information. I mean, there is a series of data that or the information that are there, that are the disease fact sheets, that they don't need to be updated quite often. I mean, because it's a stable situation. And then there are data on cases of the different diseases. Those data come from the original sources, that is the ECDC. So this is immediate. So I mean, the idea of the portal is not that the portal itself has all the information, but that it refers when needed and when possible to the original sources. So if you click or if you requested the number of measles cases, immediately the portal is going to send you to the ECDC, to the maps that are continuously updated on measles or rubella, whatever you request to do. So I think that this is the beauty, if I can say like that, of this portal, that is an entry of different sources, but it's an organized entry for different sources, and that make easy for the public, for the non-specialists to go to these different sources and to have the basic information about everything.
Thank you. I have another couple of questions that are, let's say, to some extent also a bit political. So feel free to take them or not. The first one is one of those that is on every, I think, on every newspaper. So do we have, or are we going to have enough doses at the end of the day?
Okay, I mean, I said we have bought 2.3 billion doses. We are 500 less now that we don't have the UK, but let's say 500 million citizens in the European Union. If we need 2 doses, we will need just the double, so 1,000. We have enough. We have more than enough, but we will not have all of them tomorrow. We will need to wait and what we have seen, we have been saying is that what we expect is to have substantial number of the population vaccinated by June. So substantial number of the population. It depends. I mean, we have just bought more doses of Pfizer. You know, this has been announced. In case that the other vaccines are delayed, so we have been, those 2.3 billion doses has been bought by 6 companies in different numbers. Now we have 2 companies with the approved vaccines, and there is another one, AstraZeneca, that we hope to have approved in this conditional approval by the end of the month. So if the companies are increasing the production, increasing the capacity and the production to have doses for everybody. So yes, we will have enough doses, but we will have to wait a little bit, and in the meantime we will need to continue to take the preventive measures, that these non-medical measures that have been already I mean, requested and announced by the authorities, the mask, the social distance, etc., etc. Over.
Okay, thank you. And the final question is really, I would say, the question of the day, and I think it's impossible to miss it after what has been published this morning on our newspapers, particularly on Politico. Do you want to comment the discussion about the transparency of the contract between the UA and the companies? Up to you.
I mean, you know, the Director General was in the Parliament 2 days ago, talking to the members of the Parliament. The contracts are like any other contract. I mean, they have a part that could be public, another part that is not public at this moment. But what is important to remember is that every single member state has been present in the drafting of those contracts. So there was a steering committee that was composed by the Commission and the 27 representatives of the 27 member states that were discussing with the companies, and this since June. And so nothing that could be negative, or I don't know how to say, because then if there is, I mean, if someone is attacking the company or is attacking the Commission, that means that we or them will have to have convinced 27 representatives of 27 member states at the same time. So, I mean, be confident that we have done the best in the interest of the EU citizens, and that we had the best contract that we could have, and one result is that we have these 2.3 billion vaccines that will be available.
Thank you for having taken the question. Thank you for having been here today. We hope to continue this dialogue with the Commission, as we said also during the meeting with both with the Commissioner and with the Director General. We feel as really crucial in this moment, and although we understand how difficult it is, to maintain an open channel of communication with between the Commission and the patient community. For us, it's not only a matter of being reassured or of being informed, but it's all about engagement. It's the reason why we are here, and it's fundamental what's happening between us, and we hope we can go on in this direction over the next month. Let me wish you good luck, because there is a long way down still in the next months, and we know how difficult it will be. We are here for cooperating and for supporting where and when it will be possible. Thank you.
Thank you very much, and we hope to continue this collaboration, and really we need your support. As I said, to insist that everybody that is offered has to be vaccinated, and that there will be vaccines for everybody with the time. Thank you very much.
Thank you. Thank you. And so we go to the closing remarks of this meeting. Let me thank every participant for having been here today. We have seen also from some of your comments on the social that the guide is raising attention. From tomorrow morning, it will be published and it will be available. Follow our social media channel, our website, and the main message is share it. Use it, share it. If you want to use part of it, just get in touch with us, and we will be more than happy to cooperate. It's essential in this moment to not stop informing patients. So let's not make any step back on these. Information, reliable information is essential. It takes time. It requires a lot of resources and a lot of effort, but it is the thing to be done in this moment. Let's work together. This is the invitation that EPF wants to make to everybody here, to every stakeholder present today. Cooperating in this specific moment is essential, but cooperating in general is what we have been claiming as patient community over the last 20 years. This is the first time in history that we are living a pandemic in an historical period in which the patient movement is strong enough to be engaged and not only consulted. So we are taking this as a huge responsibility, but we have the instruments, the capacity, and the qualities for succeeding in this challenge. We need to get out of this pandemic stronger as patient organizations. EPF is here also for supporting each member's organization that needs any support in this specific moment. For this reason, I'm inviting you also to save the date for the 28th of January. It's a 1 hour and 15 minutes meeting. It will be very, very important. We will address in detail some of the questions that I've also raised today about specific patients communities or specific cohorts of patients, but also trying to understand more about safety, the safety of the COVID-19 vaccine. So we will have this meeting that will be moderated by Nicola Bedlington, that you all know. I will be present together with Professor Jean-Michel Donier, that is the WHO Global Advisory Committee member on the vaccine safety, COVID-19 vaccine safety, and with Professor Guido Rasi, that was the former executive director of the European Medicine Agency, in charge till a few weeks ago. So I think we have an extremely important panel that can deliver important information. So please take this invitation, share this invitation, take your friends, take your colleagues. It's important to be there. Stay in touch with us. Let's work together. See you soon, hopefully in person. Thank you for being here. Bye-bye.